Hello, good evening.
Good evening, Doctor. Good to see you again.
Good
Um,
evening, sir.
Good evening, nice to see you. First of all, I would like to ask um, about the last lecture. Uh, um, what about it? Was it the anesthesiology lecture or
No, nobody showed up, doctor. There was no one there, so we all
really?
kind of just left. Yeah.
Okay, I think that's why they asked me to continue the surgery course, and anesthesiology lectures will be at the end of the surgery course. So today we are going to discuss wound healing, first part of the wound healing. Well, let's get started. I think you can see my slide about wound healing.
Yes, we can.
All right. Um, so, what is the wound? Definition of the wound. Um, First of all, this diagram shows the wound in a um, common meaning of the wound. It's a damage of tissue, isn't it? But also there is a another meaning of the word, another definition of the wound. A break in the normal continuity of a tissue. So any break, closed or open, can be interpreted as wound. So any break. Um, but on this diagram, only the superficial wound is shown. So it is a break of the skin. It can be cut or tear of the skin, damage of the skin, and some wound with the base of the wound, a surface or walls of the wound cavity. So it is just simple wound, but look at it. This is the another view, more general, more universal definition of the wound as any break, any damage of the tissue. So wound can be mechanical. Mechanical means that it's cut or tear of the tissue caused by the mechanical force. It could be chemical damage, or actually burn of the chemical burn of tissue. It can be caused by acid substances or base substances, or anyway, it is corrosive substances which are chemically active and interact with the tissues and damage them. A wound or a damage of the tissue can be caused by radiation, by thermal injury, by high temperature is burning, or low temperature is freezing. But anyway, it's also the damage of the tissues. Bite is also the special kind of wound, because it could be associated with severe infection or from the microbes of the oral cavity, or rabies. Now, mechanical wound. It could be open or closed. So if the skin is not damaged, there is a not defect of the skin, then it is closed. So it could be contusion of tissues. Contusion of tissues is the damage of the internal structures without breaking of the skin and without the obvious hematoma inside. But small, many small hematomas occur in the damaged tissue, which can be seen on histology. Hematoma cavity, hematoma, it's the blood clot inside the tissues. That means damage of the vessel, blood vessel, and extravasation of the blood, which forms the cavity because of pressure inside the vessel. And this cavity is full of the liquid blood, but then blood forms clots, and there is a clot in tissues. Crush injury, this is also specific closed, kind of closed wound caused by the great extreme amount of force applied over a long period of time. And all of us are familiar with open wounds. So it could be incision. Incision means it's made with sharp instrument. That's why such wound has even edges, smooth edges. Actually, it is cut. Laceration. Laceration is tear, actually, tear of the wound, of the tissues, including skin. And it is caused not with the sharp, but blunt instrument or blunt agent. Abrasion, it's the damage to the skin when skin is rubbed away by friction against the force. Puncture, it's the same incision, but it is specific because puncture has narrow wound, but deep and long tract inside. So the puncture can be in one area of the body, but it can damage the organ which is far from this area because of long and narrow tract. Wound can be classified as penetrating wound. Penetrating wound enters body cavities. For example, thoracic cavity, pericardial cavity, abdominal cavity, joint cavity. This is penetrating wound. Missile wound, this is the actually the battle wound caused by the gunshot, for example, by the missile which has very high velocity, and the specificity of such wound is that not only the tract of the wound is damaged, but also the tissues around. This is called cavitation phenomenon, when high velocity missile passes through the tissues, it actually cuts the tissues and makes tracts inside, like puncture wound, but beside, it also damaged the tissues around by barotrauma. This is called cavitation phenomenon. And avulsion. Avulsion is the kind of damage when high, very intensive force detaches the tendon from its normal point of insertion. For example, detachment of the long head of the biceps muscle, It is an example of avulsion. Now about infection. So regarding infection, wound can be clean. So clean wounds contain minimal or virtually no microorganisms. Such wounds heal quickly, close primarily, and they heal without inflammation. Infection rate is very low. It can be surgical wound when we make cut with all the rules of aseptics and antiseptics. So with sterile environment, in sterile environment with sterile instruments, after the preparation of the skin with the antiseptic solutions, after the preparation of our hands with antiseptic solutions, and we wear gloves. So it is measures to prevent spillage of the infection inside the wound. So such surgical wound is the example of the clean wound. Clean contaminated wound. It is wound when actually contaminated areas of the body are transected. For example, respiratory organs of the respiratory system, gastrointestinal organs, biliary system. These organs are entered, and also there are microorganisms inside these organs. But this transection or incision of these organs is controlled. So we place sterile gauze around. We use antiseptic solutions to avoid the spillage of infection. For example, appendectomy. The appendix is transected, but we try not to touch with the appendiceal stump edges of the surgical wound or any other organs, and we use betadine solution to prepare the stump of the appendix. So it is controlled transection. In this case, contamination of the wound and inflammation is possible, and the wound infection rate is about 10%. Contaminated wound. This is the wound when the wound primarily contains the infection. It is open, fresh, accidental wound, or break in the sterile technique during surgery, or spillage of contents from the GI tract, but we react quickly, wash out, aspirate the contents, and use antiseptic solutions to irrigate this area. It is the complicated appendectomy when there is a rupture of the appendix and spillage of infection in the right iliac fossa during appendicitis. Bile spillage during cholecystectomy. Colon diverticulitis surgery with the local pericolic abscess, and so on. So in these situations, the wound is primarily infected. That's why surgical wound infection rate is high, more than 30%. And so-called dirty wounds. Actually, they are contaminated wounds, but quite old, not fresh, quite old contaminated wounds. When besides the spillage of the infection, the reaction on this infection occurs. It is inflammatory process, peritonitis, abscess formation. Of course, after such dirty wound, the surgical site infection rate is nearly 100%, and also this can get complicated with generalized infection and sepsis. Wound healing actually is the wonderful process. Imagine accidental wounds and they close spontaneously, they heal spontaneously, or this process, wound healing, gives opportunity to surgeons to make surgical interventions, because we know that after our procedure, wound will heal. But many factors can affect wound healing and lead to complications. These factors are local or general. Among local factors, foreign body in the wound affects wound healing. During one of our previous lectures, I demonstrated the sinus of the surgical wound, which was caused by the stitch, old stitch. So in this case, the stitch is the foreign body, and such sinus, such infectious process will not ever heal without removal of this stitch. But after the removal, it closes quickly in few days. Also, surgically inserted endoprosthesis can be foreign body. So when we use endoprosthesis during surgery, we try to keep the wound sterile, because in case of infection, these two factors, foreign body and infection, will lead to failure of the operation and will lead to the tract or wound which will fail to heal. Local ischemia also affects wound healing, because wound healing needs oxygen and nutrients as a building blocks for new tissues. That's why lack of blood circulation or arterial or venous insufficiency affects wound healing. Also, neoplasia, so tumorous cells inside the wound affect healing, because tumorous tissue is imperfect tissue which has imperfect blood vessels. They cannot guarantee normal blood supply. Radiotherapy suppresses division of the new cells and wound healing. Neuropathy means the damage of the nerve which supplies the area of the wound. It is also affects wound healing. Any kind of stress, damage affects wound healing. That's why during surgery we must be careful. We must be gentle with tissues. We use precise instruments and precise technique not to damage the tissues. We damage only tissues which is necessary for the procedure. And general factors affecting wound healing. It is malnutrition, deficiency of vitamins, nutrients, microelements, diabetes mellitus. Diabetes, actually, if uncontrolled, is quite severe condition which causes diabetic angiopathy, neuropathy, also high concentration of the glucose in body could stimulate the bacterial division, multiplication. Aging, also aging is the risk for wound healing. Elderly people can have difficulty with wound healing. We will discuss this later. Diseases of the liver, usage of steroid medications for a long time, immunosuppressants, chemotherapy medications, they affect multiplication of cells, including the young connective tissue or granulation tissue, which is the main process of wound healing. And congenital conditions, congenital diseases of the connective tissue. Ehlers-Danlos syndrome or epidermolysis bullosa. These conditions mean that the connective tissue is weak and it leads to the poor scar formation. Classification of the wound as an acute or chronic. So usually acute wound is a wound which lasts for 4 to 6 weeks. So after 6 weeks, it is chronic wound. So in 6 weeks, acute wound must heal completely. Examples of the acute wound are surgical wounds, bites, burns, abrasions, superficial wounds, traumatic wounds. But chronic wounds fail to heal, and it happens primarily in patients which have a risk factor for the wound healing. It is diabetes, obesity, smoking, immunodeficiency, cancer, chemotherapy medications, affected blood supply, like chronic ulcers of the leg or foot, including diabetic ulcers, venous ulcers. So what are the major types of chronic wounds? So it depends on the reason. So if reason is vascular, it could be venous insufficiency, thrombosis, varicosis, and venous congestion, which affects the absorption in the venous endocapillaries. Arterial ulcers are caused by the diminished arterial blood supply, and in this case, the reason of chronic wound is insufficient supply of oxygen and nutrients from the arterial end of the capillaries. Special cases are diabetic ulcers, when several factors participate in delayed wound healing. It is diabetic neuropathy, diabetic angiopathy, So diabetes affects small arteries and presence of high glucose, high concentration of glucose in the intercellular space. Pressure ulcers. So pressure ulcer is caused by the continuous long pressure on tissues. And the reason could be, in most cases, the reason is the patient's own weight. So patient compresses its own tissues against the bed. So immobility is the reason for pressure ulcers. So healthy people change position in bed and avoid pressure ulcers automatically. But if the movement is affected because of the poor general state of the patient or immobility because of the neurological conditions, then pressure ulcers are very common. Actually, how do the wound heal? So the wound heals. How does the wound heal? So wound heals through several patterns, and actually there are three patterns: primary intention, secondary intention, and tertiary intention. So now let's discuss the healing of the wound by primary intention. This kind of healing occurs when edges of the wound is even and smooth, and the wound is clean of the foreign body, of the clots or damaged tissues. Usually such wounds occur in the operating theater. It is, or it can be just accidental wound with minimal amount of infection inside. But in the operating theater, usually we use yearly suture. So we apply suture in first 6 hours on the wound, or immediately after the surgical procedure. Such wounds heal quickly, rapidly, within 2 weeks, and they form very gentle hairline scar. So this is the connective tissue which fills the gap, but this tissue is hairline. But another pattern is secondary intention. This kind of wound healing happens when the wound is full of clots and infection, and edges of the wound are separated from each other. Such wound is not sutured, and the edges are not smooth. The epithelium is lost. In this case, wound heals from the base. So from the base of the wound, granulation tissue, new, young connective tissue, fills the gap of the wound, and then epithelium covers it from above. Such healing lasts much longer than primary intention, and it leads to significant large scar. After several months or years, this scar retracts and it can lead to the wound contracture. So we discussed two main patterns of the wound healing. It is primary intention, healing by primary intention, and healing by secondary intention. So this is the comparison of these two patterns. So which wounds heal by primary intention? Clean wounds, while secondary intention, unclean. Primary healing, primary intention occurs when there is no infection or minimal infection in the wound. But secondary healing may be infected. Margins are clean during primary intention and irregular during secondary intention. Healing process leads to the minimal scar, gentle scar, while during the secondary intention, scar is significant. Healing period is short for the primary healing, primary intention, and long for the secondary intention. And healing is direct during primary healing, while secondary healing means healing from the bottom of the wound. And the special case is tertiary intention. So it is again contaminated wound which heals by the secondary intention. Look at it. This is the wound which heals by secondary intention because the edges are far from each other. It is not clean wound. And it heals from the bottom and edges of the wound. And in order to facilitate healing, to accelerate healing process, late closure is administered. So granulated wound is sutured. So secondary sutures are placed on the granulating wound, and such healing is called tertiary intention. Now let's discuss the process of wound healing. It has four phases, but look at it. Several phases overlap each other. For example, on the third day, there is a hemostasis process and also inflammatory phase. That's why sometimes it is called hemostasis inflammation phase. Also here, proliferation and granulation phase overlaps with inflammation and remodeling phase. So days 1 to 3 is phase of hemostasis. 3 to 20 is inflammation. From 1 week to 6 week period is proliferation and granulation phase. And from 6 weeks to several years is remodeling or maturation phase. The purpose of each phases are, of course, hemostasis is the processes which stop bleeding from the wound. Inflammation is the process which prepares framework for the activation of the cells which participate actually in healing process. Proliferation and granulation is the phase when new tissue, fresh connective tissue is generated. So new cells and new intercellular matrix is created. And final phase, remodeling and maturation, is transformation of the scar. It becomes hard and retracts. So these phases are actually are caused by the cells which are inside the wound during these phases and participate in several very important processes. So first cells which are activated in the wound are platelets. Actually, they are not cells because they are just parts of the megakaryocytes, you know. But anyway, platelets release biologically active substances which launch the cascade of processes which leads to the activation of neutrophils, monocytes, macrophages, migration of the macrophages in the wound. Then macrophages clean the wound and activate the other cells, fibroblasts. Fibroblasts generate new tissue. Endothelial cells, activated endothelial cells, generate new blood vessels and new tissue forms. And fibroblasts also participate in the generation of new tissue. This is the diagram which shows presence of different concentration of the different cells during different phases of the wound healing. Look at it. Firstly, neutrophils are prevalent in the wound, then macrophages, then fibroblasts, and lymphocytes. And this is the transformation of the intercellular matrix. So collagen 1, fibronectin is the first, fibronectin, then collagen 3, which is transformed to collagen 1, and this is how tensile strength of the wound gradually increases along the maturation of the wound. So first phase of the wound healing, coagulation, inflammatory phase. So actually they are separate phases, but during first days they overlap, coagulation phase and inflammatory phase. So as I already said, main participants are platelets. They degranulate, so they contain granules of biologically active substances. There are several substances, but most important are platelet-derived growth factor and transforming growth factor A1 and 2. They activate neutrophils and macrophages. Release of oxygen species kill the microorganisms, and they have antimicrobial effect. And proteases released by these cells clean the wound. They destroy foreign bodies, clots, and facilitate cleaning of the wounds. Okay, so platelets are activated by the contact with subendothelial collagen. So in every wound, the blood vessels are damaged. So this will lead to the contact of the subendothelial collagen and platelets. This will lead to aggregation of the platelets, so they form clots, primary clots, degranulation, release of biologically active substances, which lead to two process cascades. One cascade is the activation of the coagulation process. We will discuss this process during our next lectures. And also, very important biological substances, platelet-derived growth factor, transforming growth factor beta, platelet activating factor, fibronectin, and serotonin, which cause migration of the polynuclear leukocytes and monocytes. So this is very important. So they stay in area of the wound during circulation. Some cells have also mobility, and can actually migrate towards the wound. And these substances, biologically active substances, are like smell, which attracts these cells. And as a result, the cells inside the majority of cells inside the wound change. And now it is macrophages and neutrophils. It is the inflammatory phase of the wound, which lasts from the 3rd day to 5th day, but sometimes more. Sometimes it starts immediately after the damage of tissues, together with the coagulation phase. And first result is vasoconstriction. The biological effect of the vasoconstriction is hemostasis. So the biological purpose of the vasoconstriction is hemostasis. It facilitates blood clot formation, further aggregation of platelets, activation, and inflammatory mediators, especially serotonin, causes vasodilation. So vasoconstriction, which is in the initial phases of the wound healing, is changed to vasodilation. Now, wound becomes red, inflamed, painful, hot, blood flow is increased, and this increased blood flow brings more cells in the wound. Now, the major substances in the wound are cytokines and inflammatory mediators. Tumor necrosis factor alpha is very important substance which launches the angiogenesis. Angiogenesis is the formation of new blood vessels. So we need new fresh tissue to fill the gap between edges of the wound. This fresh tissue needs blood vessels, arterioles, venules, capillaries, and tumor necrosis factor alpha facilitates this process, activating endotheliosites. And macrophages remove bacteria and dead tissue debris. So macrophages clean the wound. Also, they release oxygen radicals, oxygen species, which also have antimicrobial effect. Unfortunately, they sometimes damage the normal tissues also, but during initial phases of the wound healing, it is necessary to clean the wound from infection. So the result of the coagulation inflammatory phase is three very important processes. It is the cell proliferation, intercellular matrix formation, and angiogenesis, formation of new blood vessels which supply new tissue. Fresh connective tissue gradually fills the gap between the wounds. After that, it is covered by epithelium from edges. So reepithelialization is the process when granulating tissue, new connective tissue, which fills the wound, is covered by the epithelial cells from edges of the wound. Okay, so angiogenesis. Angiogenesis is a very important phase of the moment of the wound healing because newly generated blood vessels must supply fresh connective tissue with nutrients and vitamins, oxygen, and building blocks to generate the intercellular matrix. Actually, old blood vessels are activated, and division of the endothelial cells will lead to the branch formation. Then these branches meet with each other from the opposite sides of the wound, and new vessel starts passage of the blood. Now, how collagen is synthesized. So collagen is main substance of the intercellular matrix, which guarantees the tensile strength of the wound. It is quite a long process. It starts with the synthesis of the pre-pro-alpha chain. Then it is in the raw endoplasmatic reticulum of the cells, of the fibroblasts. Then it is modified to, and pro-alpha chain is generated. Then chemical transformation of the pro-alpha chain leads to the helical structure, which is called procollagen. And such procollagen leaves the endoplasmatic reticulum and cell membrane. Then cleavage process of the procollagen leads to the formation of the collagen. Then several collagen fibers gathered aggregate to form thick aggregations of the collagen fibers. This is the process of collagen synthesis. Another process is the synthesis of the glucosaminoglycans. Disaccharide units join to form polysaccharide chains, and such polysaccharide chains are ground substance or building blocks for the tissues. Glucosaminoglycans join with proteins and they form proteoglycans. This is the intercellular matrix which connects the fibroblasts. This is this is the cell membrane, and integrin is connected to the cell membrane with one end and to the collagen fibronectin with another. Other substances of the intercellular matrix are gel-forming polysaccharides and collagens. And this is the process of re-epithelialization. So after the formation of the new connective tissue or granulation tissue, which is covered with epithelial cells, which come from the edges of the wound. And this is how it happens. But if the edges of the wound are far from each other, then it can lead to the chronic wound or ulcer. That's why very large wounds fail to heal, and they need the transplantation of the skin, or at least transplantation of the epidermis, which is the epithelium. And last phase of the wound healing, which starts from the weeks and lasts for several months or years. This is the actually changes of the intercellular matrix, not in the cells, because cells just the number of cells decrease inside the scar tissue, but the scar itself becomes hard and small. So why? This is the long process when collagen type 3 is gradually replaced by stronger type 1 collagen. This increases the strength of the scar tissue. And the result scar, I think everybody has such old scar, which is avascular, that means white, mature, hard, and small. Key points, key events of each phase are listed here. So for hemostasis and inflammatory phase, proliferation phase and maturation remodeling phase. Each of these events are very important. But please pay attention in this on this column here. These are nutrients, vitamins, and microelements which are essential for normal wound healing and for each phase. Look at it: vitamins A, C, K, iron, zinc, protein, fat, carbohydrates, vitamin A and C, copper, manganese, because these microelements are not very important for everyday life, because they are, of course, they participate in different processes, and their deficiency can lead to many symptoms. But regarding the wound healing, they can actually prolong the wound healing or even cause unhealed wounds or ulcers. That's why these supplements in the food are essential for wound healing. Now, let's discuss some syndromes, heritable diseases, and conditions which affect the connective tissue, the quality of the connective tissue, and as a result, function of the connective tissue. Ehlers-Danlos syndrome. This is a connective tissue disorder which leads to the weak connective tissue. That's why joints are loose, skin is stretchy like this, and scar formation is affected. Patients have imperfect connective tissue, including adventitia of the vessels. Vessel walls are imperfect. That's why easy bruising, hematoma formation is common. Connective tissues, especially transversalis fascia of our body, prevents from hernia formation. That's why such patients develop recurrent hernias. Also, they can have frequent GI bleedings, gastrointestinal bleedings, hiatal hernia, diverticulus of the intestine, rectal prolapse. So connective tissue is most hard tissue which holds something, protects from hernia formation, and because during the Ehlers-Danlos syndrome, connective tissue is damaged, so this function is lost. Formation of aneurysm, varicoses, arteriovenous fistulas are common during this syndrome. It is possible to detect the presence of this syndrome by genetic tests. Marfan syndrome is also inherited. You know well this syndrome, genetical defect. It also leads to the formation of hernias, aneurysms, and other symptoms are hypermobile joints, arachnoid fingers, arachnodactylity, lax ligaments, pectus excavatus, osteogenesis imperfecta. This is called also brittle bone disease. This is the genetical mutation of the gene which controls the type 1 collagen quality. That's why the patients develop osteopenia. Their bones are fragile, joints laxy, ligaments laxy. Bruisability is typical, formation of hernias. Also, blue scleras. Blue scleras are typical for this syndrome. Epidermolysis bullosa. It is actually severe syndrome when skin layers of the skin are not properly attached to each other. So look at it. This is epidermis, and dermis. And here is the basement membrane, and cells of the epidermis, and the link connection between the layers of the tissues of the skin is damaged. That leads to the bulla formation. Bulla is the cyst filled with the fluid, and gradually this bulla gradually peels off the layer of the skin, like in this photograph. It is awful disease. Of course, such patients, not all the patients develop such epidermolysis as in this photograph, but their wound healing is always long and imperfect. This is also very interesting condition, acrodermatitis enteropathica, and I think you remember that zinc is important for many stages of the wound healing. So look at it. Zinc is here, zinc, and here also zinc. So zinc is essential microelement for proper wound healing. And this is the condition when patients are unable to absorb sufficient zinc from the breast milk or food. That leads to the zinc deficiency and impaired granulation tissue formation. And such erythematous pustular dermatitis around the body orifices are typical for this condition. Okay, this was the first part of the wound healing.
Excuse me, doctor. I have a question.
Yeah.
When will be the final exam, and this semester will end? At which in January? Final exam.
Yes.
When
Yes.
will be?
What about the final exam?
In which date it will be? Do you have an idea?
Date? Which date?
Yes.
Just a second. If I have information. No, I only have information about 2 midterms, not about the examination. You must ask the examination committee or dean. second midterm
Okay, thank
is
you.
on December 15. Second midterm. I have no information yet about the final exam. Any other questions? Okay, then I think we can complete now. And next Tuesday, we will discuss second part of the wound healing. Okay.
Спасибо. Спасибо, доктор.
Okay. Goodbye. Have a good evening.
Пожалуйста.